Well, we're so lucky and privileged to have a veterinary specialist up the road in Potters Bar who believes what we believe in that natural health is very important for our animals, just in the same way as we believe it is for ourselves. So Richard is going to talk to us tonight and tell us all about natural healing, natural health for our pets. I had to turn Richard to several people who wanted to bring their pets down tonight, but I thought the idea of having animals running in all directions chasing each other was probably not the best thing. So it's a great pleasure to hand over to you. Thank you.
Oh, I could have.
Just about being that.
I wouldn't want to see myself though.
But the idea is then you can look at it and see, I don't like that bit, or...
Thanks very much. Well, thank you. First of all, thank you for coming out on a miserable, wet January night. It's much appreciated.
Anything away from Brexit.
Well, I was going to say, you could all be more interested, like going to a Brexit party. Would you rather be doing that, or a Brexit wake, maybe? Well, I came in blue and white and red, just to be, Brexit. So there we are. Now, just a quick. I want to say, I'm not far off 70 years old, and sometimes I lose my train of thought. So if I suddenly stop and go blank, give me a few seconds and I'll get back on track. See, and I'm falling apart already, electronically as well.
Hide those wires.
Fine.
Behind you. It's more discreet.
More discreet. That's good. Yes, I'll start with the embarrassing bit, which is shamelessly pushing my book, which, should you wish to buy a copy, it's Heal Your Dog the Natural Way. There was a companion book, Heal Your Cat the Natural Way, but when it was republished, the publisher didn't want to do that one, so they just got the dog republished. But should you wish to purchase a copy, I have a few here, and it's £14.99, and worth, 99 pence anyway. And if you wish, I could always sign it for you as well. So that's that. Going back to Brexit for a second, before the referendum, when there was all this talk about doom and gloom if we voted to come out, and there was, the world would fall apart and there'd be plagues of locusts and so on, Michael Gove came up with, I think we've had enough of experts. I think that's very true sometimes. And what I don't claim to be is an expert. Yes, Tim?
I'm very pleased, Richard, that you don't claim to be an expert. I went to an eminent professor of forensic medicine's lecture at the Wellcome Institute many years ago, and he started off with saying, I'm not an expert. And everyone went, well, of course you're a world expert. And he said, no, you know what an expert is? Well, the definition is, first of all, X means a has-been, yes. And then spurt means a little drip under pressure.
Yeah. Very true.
Excellent.
So I do know a fair bit about a few things, and a bit about some other things, but, don't take everything I say as gospel. But, I will hopefully entertain you and talk about natural health. But I thought what I might do is, go back to expert. I'm still learning, you see. That's the point. Every day I still learn something new. And interesting, the other day a dog came in, a new patient, and it was a breed I'd never seen before. So I said to the owner, I said, what breed is this? He said, one of these designer breeds. Oh yeah, what is it? It's a dog crossed with a magician. I said, what do you call it? It's a Labracadabrador. There we are. Anyway, that was hopefully the entertaining bit over. So, yes, what I thought I'd do to start with actually is just really tell you about how I came to what I do now. It's quite a long story, but I think if you don't mind listening, it's actually quite interesting. I was born and brought up in the Black Country, which is an area of the West Midlands, west of Birmingham, which is called the Black Country because in the days when I was growing up, or before I was growing up, it was full of coal mines and blast furnaces, and the air was black. Even when I was growing up in the 50s, which was when most of the mines had closed down, it was still pretty grim. And there were a lot of slag heaps, and there wasn't much greenery. And my mother's father was a coal merchant, my dad's father was a builder. There was brick dust and coal dust in their lives, although they lived to a ripe old age, I'm glad to say. But about half a mile from where we lived, there was a little sort of patch of greenery called Hayseach. I had a pond and a stream and willow trees, and nature was there. And I used to trottle down there when I was young, because in those days your parents just said go off and do your own thing, you know. So I went down there, and I spent all the day there just catching sticklebacks and, you know, all the sort of leeches, and I'll bring them back home in jars. And my mother, who was very understanding, let me have a whole room of the house just to keep these things in. So I had aquariums with, say, sticklebacks, leeches, all sort of pond life, and vivariums with all stick insects as well, and this room was just my little world, and that's where my love of nature began, and that leads on to what I did next. So and then books came into my life, and I began to read voraciously, and one of the first books I read was the Durrell books, Gerald Durrell. And it's wonderful seeing the series of Durrells on TV recently, wasn't it? I mean, my memories, I don't remember the stuff about the people, just the animals. So I wanted to be a naturalist. That was my aim in life. And then I went to school, and I was one of those people who could just luckily pass exams, so I did quite well. And I got to my A-levels, and I realised that there's not actually many jobs going as naturalist. So what else could I do? And the nearest thing seemed to be a vet. Now, I never had pets at home, apart from my little caterpillars and creepy crawlies. Didn't have pets at home. And when I went to veterinary college, I'd never had a pet in my life. I'd never been in a vet's in my life. Now, I mean, these days you can't do that. You have to sort of see practice and work with the RSP saying. So in those days, if you got your grades, you could go to veterinary college. And I did, luckily, just about. So I wasn't really that keen to be a scientist. I used to love English at school. That's why I love my reading, and biology, the two things. But I realised that I had to focus on the biology, and to do that you had to do the sciences. So I had to do physics, which I hated, and chemistry I didn't like. But I had to do those to keep on with the... At my school you had to do either the arts or the sciences. You couldn't do a mixture of both, which is a great shame, I think. But I still do some writing, as in the books, and I write for a pet magazine once a month, and I've written a few, but that's just a side issue. So that was my way in to be a vet. So I got my grades, went to veterinary college, which is the Royal Veterinary College in London, and you spend 3 years in Camden Town, 2 years out at Brookmans Park, where I happen to now live, strangely enough. And about halfway through this course, I actually thought, do I really want to do this? The first 2 or 3 years at veterinary college, it's all about anatomy and physiology. You don't actually meet a live animal at all. It's all the dull, boring stuff, but you have to do it to get there. But towards the end, I actually realised, yes, I do want to be a vet, but I want to be a small animal vet. I didn't want to be a James Herriot and put my arms up backside of cows on cold moors, and that wasn't for me. You know, I'd also put off because well, you have to do it at veterinary. You have to do a whole lot of courses at veterinary college, and I was injecting a cow in the neck, and it turned round to look at me, and it was a horned cow. So it hit me sent me flying. I saw stars and thought, I'm never going to treat things that are bigger than me. I treat things that are smaller than me. So once I left veterinary college, I specialised purely in small animals, and I'm glad I did. I mean, I like animals, I like farm animals, I like horses, but...
What's the definition of a small animal? Is it hamsters and mice and...
It's, no, basically, it's you don't do either farm work, which is the sheep, cows, cattle, or small, which is dogs, cats, and anything smaller.
It includes dogs and cats.
It includes dogs and cats, yes, exactly. The small furries, as they call them, are also often called exotics. Not that rabbits are very exotic, but they tend to be called exotics because they're just not the mainline dogs and cats. So there we are. And when I first qualified, vets didn't know much about rabbits or guinea pigs. Dogs and cats were fine, but not the others. But nowadays, most vets know quite a bit about everything, really. So that was how I started. And going back to the reading, the Durrells was one thing, and that got me into the natural world and eventually a vet. I read a book in the early 60s by somebody called Rachel Carson, which is called Silent Spring. And that was, I think, pretty much the first book about the environment and what man was doing, or man and woman was doing to the environment, mainly about the effect of DDT and how it was killing everything. Silent Spring, because nothing was alive. And that made me realise about the connection between, human life and the environment and animal life. And that's a trace I followed through as well. I also used to like reading novels. I used to like E.M. Forster. E.M. Forster? He wrote many really good books, and there was one called Howard's End. And in Howard's End, there's a lovely phrase that starts with only connect. And then, so my memory fails me, ends up with, yes, live in fragments no longer. Only connect, live in fragments no longer. And I didn't realise then what that really meant, but that came back to me later on when I began to look at natural therapies for pets. And strangely, I used to work in Stevenage as a vet, and in the old days, we did house calls. It doesn't happen these days with vets. We did house calls, and I had to do a house call to a village outside Stevenage, and the lady there went in, saw her dog, had a cup of tea, it was very nice, and she said, "That's what you read much." I said, "Yeah, I read. Do you know the book Howard's End?" "Yeah." "This is the house." And it's not called Howard's End, obviously, but I had a quick look round, and it was just fantastic. So things come full circle quite often, don't they? That came full circle for me. So I qualified, and I worked in Stevenage, I worked in Cheshunt, and then I opened my own practice in Potters Bar. Now, all this time, this was just straightforward, conventional veterinary work. I had no thoughts of doing anything else at all. And I think by about my practice in 1980, I can do this on my own. I thought, perhaps I'm a bit of an expert now. I can treat animals. I know what to do. I can make them better. It was really good. But about 4 or 5 years later, when I'd taken on my first assistant and had a little bit more time to think about things, I began to realise that actually conventional medicine doesn't actually have all the answers. And I realised that a lot of the drugs I was using were actually causing more harm than the good they were supposed to be doing, and that particularly for chronic disease, Western medicine doesn't have much of an answer. And why I see it and saw it then was that conventional Western medicine is great at dealing with acute problems. If you've got an acute infection, take a course of antibiotics by all means. If you've got an absolutely overwhelming inflammation, maybe have a short course of steroids. If you've got a broken leg, go to the hospital, that's fine. But if you've got long-term problems, and that's really all the itises, dermatitis, arthritis, all those chronic diseases, conventional medicine doesn't have much of an answer. So that was in my mind, but I hadn't thought about what to do about it. And around that time, my wife, who had been a nurse up to that point, a human nurse, not a veterinary nurse, she'd stopped working because we got children on the way, and babies do get in the way a lot, don't they, really? Mess your life up, babies do. The thing is, they grow up and leave home eventually, which is fantastic, yes. I've got two lovely boys, and then they come back again, yes. I've got two lovely boys, both grown up, both left home. We love them dearly, and I'm not complaining at all, and they haven't come back home either, yet. So she was deciding what she might do when she went back to work eventually, and she happened to go on an introductory course in natural therapies for humans, obviously, sort of a session on acupuncture, a session on this and so on. And in the end she became a psychotherapist. That's another story altogether. But she said to me, "Is this done for animals?" I said, no, never heard of it. And weirdly, around that time I happened to see a seminar in acupuncture advertised and a weekend course in homoeopathy. I thought, well, that's odd, maybe it's somehow meant to be. So I went on them, did my course in acupuncture, came back with a few acupuncture needles. Not impressed at all, really. I thought, this is ridiculous. I can stick in a few pins and make any difference, but there we are. Did the homeopathy course, again thought, well, it just sounds complete rubbish. Really, give a little pill, nothing in it, how could that work? But I took some pills home, and I thought, well, I'll just try it out, as you do, and I just began to see good results. So I thought, maybe there's something in it. So I did some intensive training. And I must say, when you've done your 11 plus and your O levels and your A levels and a 5-year veterinary course, and you finish that, you think, no more studying ever again, this is fantastic. And then later on, you start to do it all over again. It became really hard. I found it very hard, not so much the actual studying, but just doing it while I still had a job to do and a family to look after as well. But somehow I got through it, and I got a qualification in veterinary homeopathy and did some long-term training in acupuncture. And then I began to use this more and more and more. And eventually, by, late 80s, early 90s, I pretty well stopped doing conventional work. I had 2 assistants by then, and they were doing all the conventional work, and I decided to spend all my time doing this sort of stuff. And in 1996, we were a bit crammed. It was of quite small premises. There was myself and 2 vets and several nurses and receptionists. I'm in a tiny practice, and then the next door premises came up for rent. So I decided to move next door, which I did, sell the old practice off. So I'm actually now next door to my old practice, which is now a village vet. And I do what I do now, which is just referral work in natural therapies. So that's how I got to where I am. And now I'll say a bit about what I do. Village vet, by the way, is now... what I don't like about the veterinary profession these days is the big corporate groups are buying up all the practices. Village vet, when I sold my practice, was I think about a 6 practice group. It's now about a 40 practice group, and it was being bought out by another big group called Linnaeus. Linnaeus own about 100 practices up and down the country, and Linnaeus have been bought out by Mars in the States, Mars Inc. Believe it or not. So Mars own about 2,500 veterinary practices in the States and Mexico and Canada and Europe and the UK now as well. But they're not the only one. I mean, BVetMFHom own 400 veterinary practices. And to my mind, the big mistake was our governing body called the Royal College of Veterinary Surgeons. Well, I used to bow to them and sort of how wonderful they are. About 20 years ago, they decided that up to that point, every vet had to be owned by a vet. Every practice had to be owned by a vet. They decided then it didn't matter who owned the practice, as long as the vets were doing the treatment. So anybody could own it. A veterinary nurse could own it. You could own it, as long as the vets were doing the work. And that's when the big corporates got interested and saw the profits. And now, of course, the problem is, yes, every vet is a business, has to make a profit, but now there are shareholders who are demanding more profits.
Are you all self-employed then?
No. I mean, all vets. Well, I mean, I'm self-employed, but all vets are either self-employed or they work for a practice. But they would work for the owner, so they wouldn't be self-employed. And the problem is, of course, then who decides on the practice policies? On treatments and on which drugs they choose. Allegedly, every vet's supposed to have clinical freedom, but I don't really think it happens in practice. Because the big boys decide, well, no, we're going to buy this drug because it's cheaper. You'll damn well use it. No vets here, by the way. Good, fine. Yeah, so that's my beef about vets. But I mean, it's a wonderful profession, and I think most vets, all vets, really do it because they love the animals. But there are pressures on them now, I think, to toe the party line as far as practice policy goes in many cases. And I don't like the way things are going, but I'm a grumpy old man, that's a problem. So what do I think about natural health then? This is where we got to. So I was looking at homoeopathy and acupuncture and herbal medicine and flower remedies and so on and so forth. But so my initial thing was, well, that's fine. All you need to do is find the right remedies to cure the patient, and that's it, So rather than using antibiotics or steroids or anti-inflammatories, I can just look at nice natural remedies, and for a long time, that's what I was doing. And it jolly well works too, by the way. So taking these things separately, I mean, acupuncture, the one thing I was surprised about was how good most animal patients are with acupuncture. I mean, if I was a dog or a cat and this guy came with needles to stick in you, I think I would imagine they leap a mile, but most of them don't. I would. I have a needle phobia. I'm terrified of needles. I could not have acupuncture. Really. I mean, I just pass out, literally. But most dogs and most cats are actually quite good. I don't know whether... I think perhaps because with us we know it's going to happen. So in my case, it's not a fear of pain, it's just a fear of needles going into me. But I suppose dogs and cats don't think he's going to stick a pin in me. And also they're very fine. Anybody had acupuncture here? Yeah. It's terrific, isn't it? Yeah. I mean, they're very fine needles. I mean, the old spot is a bit painful when it goes in. But the problem with dogs and cats, of course, is that you've got fur in the way. And in a long-haired dog, trying to find an acupuncture point isn't that easy, I can tell you. Or you put a needle in and you can't find it afterwards because the fur's, that's it. And every acupuncturist at some point has left a needle in, I can tell you. I mean, it doesn't do any harm, it's a bit embarrassing. Found this in my dog. Yeah, I always try and count them in and count them out, but sometimes with dogs they'll shake and lose a couple of needles and they don't put those in again or not. Oh, it's so complicated, you know. But it is true that apart from occasionally shaking out a needle, most dogs are fine. I've had 3 dogs only I couldn't do acupuncture on. One was an Afghan hound who just went completely berserk. I mean, not aggressively, just didn't want to be touched. And for some reason, 2 border collies, both of them called Billy. So whether being called Billy, they just didn't want to be touched at all. There's no point in stressing a patient too much by any treatment you give, because stress makes problems worse, obviously. So acupuncture I've found incredibly helpful for a number of conditions, particularly all the joint problems, arthritis, spondylosis, the back problems, anything to do with the musculoskeletal system, it's terrific for. But also epilepsy, all the neurological problems as well, actually. I've not had so much success with things like skin problems, can help digestive problems. The only drawback to acupuncture in a sense is you have to do a number of sessions. And some of my patients live quite some distance away, so it's not always very practicable. But most dogs and cats I've found, they get used to it. And interestingly, the only real difference between animal acupuncture and human acupuncture, by the way, is that, I mean, the needs are the same, the points are the same pretty well, but animals seem to only need a much shorter time having a session. So with humans it could be 15, 20 minutes, half an hour maybe. Mostly with dogs and cats about 10 minutes is plenty. And I think it's because they have a higher metabolic rate. So they sort of respond to it more quickly. I mean, the body temperature of a dog and a cat is far higher than ours. I mean, I'm still stuck in Fahrenheit, so ours is 98.4 normal, whereas a dog and a cat, 101.5 is their normal. So the fact that their body temperature is higher, their heart rate, they sort of calm down, they almost go to sleep sometimes, but around the time they're due to finish, they suddenly start to wake up. They always know that they're ready. Sometimes they try it on and come back earlier, but no, they usually actually know when they're ready. And so I don't even time it these days. I always dog will know when it's finished and I'll wait for them to wake up and off they go. So I think animals are very aware actually of what's going on. I like to think that they sense it is good for them having the acupuncture done.
Do you actually fall asleep?
Sometimes. Yeah, I mean not always. They tend to go sleepier, but not always fast asleep. But I have had a number of dogs who would just literally start snoring, but still towards the end of the session they start to sort of wake up and the ears flicker up they come. Sometimes they don't, they just sort of stay asleep forever. But so I've not had great problems with acupuncture, and I've seen it work incredibly well. Herbal medicine, I don't do Chinese herbal medicine. That's something which at some point, should I have time, I'd like to get that into, in my dotage maybe. But I think the other problem with Chinese herbs is that it's very hard to get guaranteed sources of pure herbs. There's so much adulteration goes on, and they've even found in some sources like steroids in these things as well, so you have to be very careful. So I tend to use Western herb medicine, and there are some really good herbs. A combination of skullcap and valerian is, I say, there are 2 common, I use that probably more than anything else. It's so good for relieving anxiety and for epilepsy and for any, again, nervous system problem where you want to calm it down. And it has this very clever effect of being not sedating but anxiety relieving. And almost every epileptic dog and cat I see, but also any dog with behavioural problems such as overreaction to noises, dogs that frighten us, fireworks, that sort of thing. Skullcap and valerian is an incredible soothing agent. And the one I use an awful lot is slippery elm. Slippery elm, the tree box. And there are certain problems I see more often than anything else, and those probably are arthritis and joint problems, skin problems, and also chronic bowel disorders. IBD, and dogs more than cats, but dogs and cats do get the equivalent of IBD, colitis, Crohn's, all those sorts of things. Boxers are very prone to ulcerative colitis, for instance. And slippery elm is something which will almost always relieve some of the symptoms almost from day one. And I've had dogs with chronic diarrhea that have been going for about 2 years, put them on Cypriel, and almost nothing else, and there's improvement almost right away. You might need other things to get there, but it's a very good symptomatic relief. And you can just mix it in with the food, it's just fine. Most dogs take it very well. Cats aren't always so easy, but cats are never easy, are they? I mean, I do love cats dearly, but I will make a few comments about them, because like most vets, I've had more damage from cats over the years than from dogs, I can tell you. I think the problem with cats is, well, they have claws and teeth, whereas dogs don't claw you to death, whereas cats will. And I think the thing about cats is they'll be sitting there absolutely calmly, looking without a care, and out of the blue, suddenly go for you. And why? What have I done? Whereas most dogs, well, they'll bite without scratching, but also they tend to give you some warning beforehand. They tend to sort of warn you off so you can back off. And I think I have learnt a bit of a sixth sense about cats now, so I tend to pretty well guess when they're going to have a go, but sometimes they still surprise me. But I do still love cats dearly, by the way. But there can be a problem about anything you do to them. They often don't like things being done to them, they don't like a temperature being taken, and they don't like taking tablets. And that is such a problem. I mean, they just you try any way you can, and you think it's gone down, and they just spit it out, or they claw you to death, and it's so a problem. So I tend to leave it up to the owners. You give your cat the pills, you'll be fine. They know you far better than me, so they pass it on. And you have to be, and you can try hiding it in food and hiding this, and they just don't have it. So there we are. That's cats for you. But I mean, they are such charismatic creatures, aren't they, cats? I mean, they're so independent, and you can't, even ones that really have a go at me, I just respect them for being cats, So then I came to homeopathy. Now that, I think, of all the natural therapy, and I feel not most at home with, but I think it's more deep acting probably than with anything else. And the reason that when I first did my initial course in homeopathy, that I just thought it just sounds rubbish, was when you look at it, it sounds rubbish, doesn't it? You take a bit of arsenic. I don't mean take it. I mean take arsenic, and you sort of grind it down, and you dilute it in water or alcohol, and then you take a drop of that, dilute it even more, and so on. And eventually, it's so dilute, there's just nothing left anymore. No molecules left at all. It can't be. It's too dilute. I often use, say, arsenic 200 potency, 200C. That means it's diluted 10 to the minus 200. So there's 200 noughts after it, which is infinitesimally dilute. So there can't be anything there. Now, interesting, there is. And this has been found fairly recently that they've looked at homeopathic potencies under an electron microscope, and there are nanoparticles. There are tiny, tiny submolecular particles in there. And they can watch those going through the dilution, they stay there. So I didn't know it at that time. It makes sense now, of course. So there is something going on, there is something still in there physically. But the idea is that it's the energy in there rather than the physical substance, but there's obviously still something physical there. So I had this sort of seminar saying, well, you dilute these things down, so there's nothing there, but the more dilute they are, the more powerful they are. Really? That doesn't make sense either. And the way you give it is you give the diluted remedy for the condition that the actual substance would cause. So if you took some arsenic, it'd give you obviously gastroenteritis and poison you. If you see a patient with acute gastroenteritis, give them arsenicum album, white arsenic. Well, that sounds a bit odd. Anyway, I took it on board, I came home and found it worked. In the meantime, I read a lot about Samuel Hahnemann. Do you know Samuel Hahnemann? The great god of homeopathy. He must be, I think, one of the most clever people ever in the world, because back in the 1700s, he worked all this out, and not just that. And the way it happened, apparently, was that he was, apart from being a doctor, qualified doctor, he was a great linguist, and he would translate articles from English to German, German to English, and French, and so on. And he was translating a treatise on the use of quinine for treatment of malaria by somebody from Glasgow called Dr. Cullen. So he said, well, quinine is a treatment for malaria. And he knew that quinine in a large dose was quite toxic. So give him his due, he took some quinine to see what happened. He took a lot of quinine to see what happened, and it gave him the symptoms of malaria, fevers and so on. But when you take a small dose, it cures malaria. So he thought, that's a bit odd. And then he began to look at other substances and doing the same kind of thing. And he got his students to take these things. And eventually he worked out there is something going on here. A minute dose of what would cause the symptoms can actually cure the symptoms that that substance would cause. So, if you get stung by a bee, take a dose of Apis mil, which is homeopathic bee. I think the reason that homeopathic remedies are given Latin names, it just sounds a bit more, real, doesn't it? Posh. So, Natrum muriaticum is a fantastic homeopathic remedy, and that is just Latin for sodium chloride, salt. But, to say to somebody, have some Natrum mur rather than have it salt, sounds just so much better, doesn't it, really? By the way, Natrum mur is a great remedy, going back to cats, is a great cat remedy. There was a famous homeopath called George MacLeod. Have we got any of his books, George MacLeod? He was doing a lot of homeopathy in the 1950s. He was almost the only veterinary homeopath. And he wrote several books on homeopathy. He was a very dour Scottish man, was George, a man of very few words, but all golden words. He hung on to them, and he said to me once, Richard, he said, every cat needs Natrum mur at least once in its life. And it's true, because cats are very prone to kidney problems, which Natrum mur treats, and very prone to overactive thyroid, which Natrum mur treats, and their whole nature is a bit Natrum murish as well. They just are Natrum mur. And going about their nature brings me on to more about homeopathy, because it isn't just about the physical symptoms. Hahnemann realised that remedies fitted in not just with the physical symptoms, but with the whole nature of the patient. And you then, because the problem is there are probably about 15,000 homeopathic remedies in the world, maybe more, always more coming along as well, always new ones coming along. So how to choose one or two of those 15,000 is a bit difficult, but the way you do it is to look not just at the physical symptoms your patient has, but particularly, most important in chronic disease, to look at everything about your patient. Their nature, their personality, their character, what's happened to them, their whole medical history, what happened when they were born. A very common remedy I use for dogs is lac caninum. And I use that for dogs that have had a problem at birth, or they weren't mothered properly, or had huge traumas as puppies, and very young dogs, because lac caninum is homeopathic dog's mother's milk. And they've missed out on that nourishment, you see, so you give it as a homeopathic remedy. And similarly for cats, it's lacphilinum for cats that have a similar problem. So you look at all these things, so it's their whole past history, their present history, and anything which might have triggered it. There's a great saying in homeopathy, look for the never well since syndrome. The patient has never been well since a particular problem happened. And one of my very first great successes in homeopathy was a 16-year-old Siamese cat who had been one of a pair of cats, brother and sister. And his sister had died about 4 or 5 months before, just of old age. And since his sister died, he'd begun to get mouth ulcers. So I saw him as a referral because the mouth ulcers just were not responding, and the client was very keen on homeopathy. So I thought, well, no, what's a good thing for mouth? Oh yes, Mercor for mouth ulcers. So I tried a few things out. Didn't get any far at all. I thought, now, come on now. This cat's never been well since his sister died. So I gave him Ignatia, which is a remedy for loss and grief and bereavement. And hey presto, the ulcer's cleared up. So it isn't about just the physical symptoms, it's the cause of them, and not just the physical cause, but emotional causes. So I do find when I meet new clients, the things I ask about, they often say, well, what's that got to do with my dog's disease or my cat's disease? There's no connection between he's got chronic skin disease and what happened 10 years ago. Well, actually there is, everything. And this is where it comes back to this only connect, live in fragments no longer, put all the bits together. Put the whole person or the whole dog or the whole cat together, look at everything about them, and then you'll get the right treatment. And that's the whole joy of homeopathy. And I think my greatest success has always been looking at those times when you've worked out not just what was wrong, but the whole. And when you get success with homeopathy, often the whole nature of the patient changes. There's a great thing that I find that very often with not just with homeopathy, but all natural therapies, that they're saying that you feel better before you get better. And I often find that I start treatment, I see the patient a month later, they've got perhaps an itchy skin, and the client comes back and says, oh, well, the itchy skin is, well, maybe a little bit better, not really any better, but he's so much better than himself. He's brighter and happier. And then you know they will get better. But often there's a delay in the physical symptoms improving, but they feel better right away. And that can be almost instantaneous as well. I mean, sometimes the physical problem improves quickly, but I tend to find, with skin problems particularly, it's a long, long process. When I was a veterinary student, I had a very good lecturer in dermatology, and he always said, gentlemen, because we were mostly boys then, when I went to veterinary college, we were, I think, 56 males and 3 females, you know. Now it's the other way around. It's all the women taking over, you know. And also, don't vets look much younger these days? They're all children, aren't they? Anyway, he said, best thing to be in life as a vet, best career, is to be a skin specialist. Because your patient never dies of the condition and it never gets better either. So you've got them for life, you know.
Semi-humans is difficult to treat.
Yeah.
So, you know,
yeah, it's just so tough, but there is not quite a rigor. There is it is very long term, and I was don't say guys, the skin problem on your dog or cat will probably take as long to clear up as it's been there for, and it could be 2 or 3 years sometimes, and it is very slow. And skin trouble is so complicated because there's so many possible causes. Interestingly, I think a lot of skin conditions have a connection with the gut. They say the gut's the second brain, you know, and we have butterflies. We describe things in emotional terms, and apparently in the developing embryo, the cells that form the lining of the intestines begin life as exactly the same cells that form the skin, and they differentiate later on, but there's a strong connection. So a lot of dogs and cats I see have both skin problems and either have or have had bowel problems, or even alternate sometimes as well. So very often if you treat one thing, you get another thing better as well. And there is also this thing in homeopathy called direction of cure, and that means that things tend to improve from the inside out. So if I see a dog with, or a cat with, say, chronic bowel problems and chronic skin problems, try and get the inside better first, and often the outside then improve quite naturally. There's also something called a direction of cure, in the sense of things often tend to heal from the front to the back and from the top downwards. And I once saw this incredible situation where I had a Bernese mountain dog who came in with a horrible patch of eczema on his shoulder. He'd been there for a year and a half. Had steroids and antibiotics and got better and got worse and got better. Anyway, it wasn't any better overall. And we began some homeopathy and it healed her perfectly. Went away completely. But it came back over the hip. And then we did some more treatment and it went down to the foot. And it went completely. You know, amazing. There's also this thing where sometimes things can get better before they get worse. Get worse before they get better, I should say, rather. And I saw it once with a dog with a cyst between its toes. And this cyst had been there again for ages and ages and ages. And I gave some, it was Ignatia again, strangely, actually. I gave Ignatia. And suddenly, all the 4 feet, blew up with cysts all over the place. And I was a bit shocked by that. But I said, don't worry, it'll get better. He said, hopefully. Okay, it'll get better, you know. Look confident, it'll get better. And within 3 weeks, they'd gone completely, never came back. But it obviously had to come out somewhere, you know. But you have to look confident, you know, things will get better. So, of all, I mean, homeopathy, there's 15,000, I would say there's probably about 100 I use quite regularly. Some of the other ones are quite rare and occasionally used. I would say that if you had a top 5 remedy, well, arnica, everyone knows arnica. You know, it's just terrific. Any tissue damage. The first time I realised how good arnica was not on a dog or a cat, it was on my youngest child. He was only about 2 years old. He toddled along, tripped over, hit his head on the corner of the table, like that, just over his eye. And this huge swelling came up, like oozing blood. So I said, arnica, be fine. Took some arnica, a dose every 2 or 3 minutes, literally, and you could see the swelling just going down again. And it was gone within about 24 hours, never came back up. So I was quite amazed by that. And my wife once surprised our dentist because she had some dental work done. And he said, oh, you'll have the most enormously bruised jaw afterwards. It'll come out in sort of, multicolours. She said, well, I'll take arnica, it'll be fine. And she was. He was so surprised. He now recommends arnica for his patients. So you can sometimes persuade the medics and the dentists of the effectiveness of natural therapies. So arnica is fantastic. If I was cast away on a desert island and had to take one homeopathic remedy and one herb, it would be arnica and slippery elm. You can do anything with arnica and slippery elm, basically. Another great one is aconite, because that's so good for shock and trauma and stress. And also, I often use it now for problems that began with a shock. If particularly in cancers, I find, if you try and look back to when the cancer first appeared, quite often there was some trauma, some stress, some shock, which seemed to happen just before the cancer appeared. So I often use aconite then, there are other ones as well, but aconite quite commonly. And hypericum is a very good homeopathic remedy for pain relief, particularly pain at nerve endings. Apparently if you hit your thumb with a hammer and take hypericum, it may well not be too painful. If you've got the time to try and find it and take it, obviously, and also, when those three together, I use arnica, aconite, hypericum to give to patients before and after surgery. And that reduces the risk of bleeding and shock and gives pain relief as well. And quite a lot of my patients now seem to respond well to that. I mean, I don't do surgery myself these days. I haven't lifted a scalpel for about 30 years. But if they're going to have surgery elsewhere, we might talk about surgery later, things like neutering and so on. That might come up. So those are three good ones. I mean, it's in the 15,000 hard to pick up, just 4 or 5. But those three I would use in really, really frequently. I mentioned arsenic, Arsenicum album, white arsenic, arsenalb, is terrific for all the gastroenteritis problems. And going back to having to fit the kind of patient, interestingly, Arsenicum album tends to fit patients who are very restless. And also they need a lot of warmth. They love the warmth, Arsenicum types. And in animal terms, quite often, for some reason, German Shepherd dogs are often arsenic. And they tend to come into my practice room and they'll sort of walk up and down. They don't settle, So in fact, doing a homeopathic consultation with animals is very much about not just about talking to the client, but seeing what these dogs and cats are doing. Are they settling down right away? Are they obviously very nervous? Are they restless? And most Arsenicum dogs will just wander up and down, won't settle even for a whole hour. They won't settle at all. They're just constantly restless. Or they'll go and sit by the radiator if it's cold, because they want to be warm as well. So Arsenicum album is great for gastroenteritis. It's also good for certain skin problems, and very often where there's skins with unpleasant discharges, excoriating discharge, they say. So that's a superb remedy. And the other sort of side of Arsenicum album is good old sulphur. And sulphur is very much that you feel the heat, you want to be cool rather than hot. And it's very much a great skin remedy. But the sulphur patient the skin often looks just dirty, or they're just very, in human terms, they're scruffy ones, Sulphur people are scruffy. I'm sulphur, I'm sure I'm very scruffy, Whereas Arsenicum album is always very neat and tidy. And Arsenicum is very fussy about things. If you're a human Arsenicum type, and you come into a room and the picture isn't hanging straight, you've got to put it straight. You can't bear disorder. You want to be ordered. Whereas sulphur wouldn't care, wouldn't care at all. So this is the sort of way in which you choose these remedies, is just looking at not just the physical problems. I mean, if you look at skin, for instance, there must be literally thousands of skin remedies, but you go on the particular kind of skin problem and what's caused it and what your patient is like. And the most difficult thing with homeopathy probably is choosing not just the remedy, but the strength, the potency. Because apart from the fact there's 15,000 remedies, they all come in lots of different strengths and potencies. And that's where there's no hard and fast rules. And it's partly instinctive. What I have found with small pets, this tries to go back to the acupuncture, is they actually seem to need more frequent dosing and on the whole higher potencies than humans. this goes back, I think, to their higher metabolic rates. They use up the remedy more quickly. They need more of it. And mostly in human terms, you perhaps might give one remedy, give 2 or 3 doses, and then wait a month. Mostly with pets, you need to give it for daily, for weeks on end sometimes. So I'll often use quite high potencies twice a day for even 3 or 4 weeks at a time. And it's very rare to get any problems with that. There are no true side effects or adverse effects to homeopathy. But interesting, if you give perhaps too much of a remedy for too long, you can get what's called an aggravation, where it sort of stirs things up too much, and you do get an aggravation of symptoms. Obviously, when you stop it, they settle down. It won't cause a long-term problem, but you can get temporary problems. So it's, even with homeopathy, even though there's nothing in there at all, and they're perfectly safe to use, you can get some odd little effects which you need to know about. There's a remedy called silica, which is actually basically flint, and that's very good at pushing out foreign bodies from under the skin, for instance. So if you've got a little thorn under the skin you can't get to, give some silica off, it'll come out again. But obviously, if you've got, there's a suspicion that if you've got perhaps a microchip, could it push that out? In fact, there's been no cases I've found. I've used silica a lot on dogs and cats with microchips, and it hasn't moved them, because I think the body walls that chip off. But you have to think about these things. I did have a dog once where it had got a metal plate in its leg, screwed in obviously, from an accident some years before. And he went on silica, and one of the screws came out. Now, I think what had happened was the screw was loose anyway, and probably been working, when it just sort of mushed it out. Talking things coming out, by the way, this is nothing to do with homeopathy. This has happened to me many years ago when I was working in Stevenage, and I had this lovely boxer dog. It was a huge boxer dog called Bruno. He was the biggest boxer I've seen in my life, and he dribbled everywhere. He'd sort of run in and he'd be dribble flying everywhere, bounce around, always happy as well. Anyway, one day he went across the road and got hit by a car, or rather he hit a car. Little Mini. Now I think that Mini was far more damaged than he was. There were literally, the owner was there, he said, there were just bits falling off this Mini, literally. And the dog was just like, I'm fine. But he had got a big cut over his shoulder, huge cut over his shoulder. Now, when he came in, I wasn't operating that day. One of my colleagues stitched him up and off he went. Fine. Came back, had a checkup, no problem, not lame, perfectly fine. It healed beautifully. And for the next 2 months, he was absolutely perfect. Then, he came back in because this huge swelling had come up where that original wound was. So I happened to be operating that day, and he came in, and I said, well, probably he's got an abscess or something. Anyway, so I knocked him out, incised into this big swelling, and this sort of clear fluid came out, not in fact just clear fluid, but my scalpel hit something a bit hard. So I put my hand in, and out came a car door handle. A whole car door handle. It obviously sheared off when he had the accident, been pushed under the shoulder muscles, hadn't been seen because it's under there, and they just went back out again. But this dog had not been lame in the slightest for 2 months with a whole car door handle. So, if I gave him silica, it'd come back to its own accord, wouldn't it, probably? So strange things happen. I mean, any vet, I reckon, who's been qualified more than a year or two could give you stories like that. You know, strange things happen. You know, I had a dog once. Shall I go and tell these stories? No, yeah, fine. Dog once who, little Jack Russell Terrier, and he kept swallowing stones. I think we had to operate 3 times for stones he'd swallowed. So he only said, well, I don't really want to muzzle him, but you know, is there any way I can stop him? Because I'm just too late when I get there, too late. So I said, well, you might try is, when you see him going towards a stone, just throw down something that makes a noise near him to distract him. And she did, it worked. For some reason, she chose a little soft bag, and inside, as it dropped, it made this laughing noise. You know the song The Laughing Policeman? It was that laughing noise, and it made noise. And it worked. I didn't see it for about 2 years. Anyway, the dog came back in again, vomiting, and obviously she said, has it swallowed something? Yes. What's it swallowed? Little bag with a... And of course, when he squeezed his tummy, there's another laughing noise came out. So after that, she had to muzzle him. Anyway, that's completely aside. So going back to natural therapies. So that's basically what I've found. Now, I'd also say this, by the way, that one of the other quotes I love comes from Donald Rumsfeld, that American, bit of an idiot, but he came out, I don't think he wasn't from him originally, this lovely saying which says, there are things that we know, and things that we don't know, and things that we know we don't know, and things that we don't know. And it is so true, isn't it? There are things we know, I know, the sunrise in the morning, that's fine. There are things that you don't know you know. I like to do quizzes. I didn't know I knew the answer to that, but you do. So things that just come up that you know, or instinctively you know. There are obviously things that you know you don't know. I have no idea how computers work, but there we are. But there are things that you don't know. And I mean, I didn't know about natural therapies for a long time. And I wish I had earlier. But, there we go. So that's a quick run through natural therapies. But what I found isn't just about treating illnesses. In a sense, we should all be doing preventive work, preventing illness and preventing disease. So what I began to look at then was trying to keep pets healthy and stop them getting ill in the first place. The problem I find doing referral work is that almost all my patients, by the time I get to see them, have already got long-term problems. You can't go back to the start, as it were. But I do have more and more people bring up saying, what should I do about vaccination, or what diet should I give my dog or my cat? And that's where we can get in there and try and more people I think are looking at, trying to keep health and to keep their pets naturally healthy and not to have to treat illness, and that's the way forward. So I'll say a few words about those, and as we go, if you want any questions, then there's some questions at the end as well, but now is fine too. So what do we start with? Well, I suppose what's most important to life, air, food and water, isn't it, really? Now there's not an awful lot you can do about the air, I suppose, except indoors, don't smoke, and make sure there's ventilation, and don't let your pans boil over just be careful. But you can't control much about the air, unfortunately. Move to the countryside maybe, or move to Scotland, but you can't do much more. Food and water, well, water obviously, clean water. I find a lot of dogs and cats are not that keen on a nice bowl of the chlorine and so on, filters, that might be worth doing as well. But just try and make sure water's as pure as you can make it, really. And I think animals tend to choose themselves. Cats, of course, are a problem, aren't they? They often, they often just won't drink. You give them a bowl of water, they won't drink anything, and you put it in there. And apparently, there is a reason. Apparently, cats don't like it if they can't properly see the water level, and they can't always see it. So they like to drink from moving water would often. Cats often love dripping taps, or water fountains are great for cats. And I think one of the reasons that cats are very prone to kidney problems as they get older is they don't drink enough when they're younger. And I think also, I have to say, vets have caused it by saying, feed your cat on dry cat food. Worst thing for cats is dry food. Now, there are some cats who won't eat anything but dried food, of course, that's where it can be a problem, but try and stop cats eating lots of dried food. And I know that it is supposed to be the case that these big pet food companies know what they're doing, but back in the, I think about 70s or 80s, they found out they were putting in commercial cat food the wrong balance of minerals, and a huge number of cats began to get blocked bladders with lots of sand in the bladder and kidney disease, and they changed it, of course. And although I'm going to go about vets again now, vets, when I was a veterinary student, and when I first began to be a vet, no vets sold pet food. That's for pet shops. And nowadays, every vet is filling with bags of science diet or any old rubbish. And diet, I think, is so important. And I think our profession has sadly been traduced by the big pet food companies into going along with what they say. And the big pet food companies, like Mars, for instance, who own a lot of pet food companies, will say, well, we've done this research that proves it. There is often about sort of 10 cats or 10 dogs. There's no big trials that prove these things. And also they don't compare their food with real food, which they should be doing, of course. So I say, well, a cat will live longer on this diet, but they don't compare it with a natural diet, which they should be doing. Just that diet. So, we have been taken over, I think, as a profession, and I think it's very, very sad that that's happened. So diet is a very contentious issue, though, because, with the present environmental concerns, should we be feeding dogs and cats on meat? you know, because where's the meat coming from? Well, obviously from farms, and we should be cutting back on farms, shouldn't we? I don't know. But my feeling is, with all pets, we should be trying to feed something as close to their natural diet as possible. Now, cats are a case in point because cats are obligate carnivores. In other words, they have to have, in the wild, they cannot exist without meat, because there are certain amino acids that they can't make naturally, you know, taurine and so on, which they can only get from meat. So it is possible to find a vegetarian or vegan diet for cat with added amino acids. So you can make it reasonably nutritious, but my feeling is that if nature intends a cat to eat meat, they should be eating meat, or fish, or, you know, but not a vegetarian diet. I do have a client, interestingly, who is a vegan herself, which I respect, and her cat's been on a vegan diet for a long time, and it became desperately ill recently, a complete immune system breakdown. And luckily, when I first saw it, it was literally at death's door. I mean, it was almost about to die. And thank goodness, it's been on acupuncture and homoeopathy. It turned around very quickly and got better, but it only began to really improve hugely when she decided she would put it back on a meat diet. It suddenly blossomed at that point, put weight on, and dear George is now completely back to normal. He's fantastic, but now she's putting him back on a vegan diet. And I'm worried about what will happen, but he's keeping going with the natural remedies, so I'm hoping that will sort of hold it in check. Now, that's not to say that every cat that's vegan will become ill like that, but I am very worried about it. And even, I must say, our veterinary associations are very anti-vegan diets for cats. Dogs are a little bit different because dogs are carnivores. Just look at their teeth, they're carnivores, they are, but they're what I call adaptive carnivores. They can eat other things as well, because dogs in the wild are carnivores and they're scavengers. So they will eat roots and berries and eggs they find and fruit. Dogs will pick berries off the hedgerows, you know. But of course they won't go and graze a field of wheat. And my feeling is they should be having a basic meat diet, but also nothing wrong with vegetables and roots and berries and fruit, but not grains. I find most dogs are much better with a grain-free diet. And mostly if you change dogs with skin problems to a grain-free diet, they tend to improve right away. And I'm quite keen on raw food diets as well. I have Bedlington Terriers, and I've had them for a few years now. My present dog is my fourth Bedlington. My first Bedlington was the first I changed to a raw food diet. And I'd been sort of convinced that this perhaps was the right way to go, but a bit scared about doing it. You know, so the first thing I did, she was about 6-7 years old, and she'd not had the raw food before. I put a bowl down with a raw chicken wing in. And she looked at this chicken wing, and she looked at me. Yeah, go on. Really? And suddenly, if she could smile, she did. She smiled, I'm sure, and crunched it, and down it went. And then she had a complete raw food diet. And all my dogs since have had raw food diets. You do have to be careful with raw food diets to get the balance right, because you need meat, but you also need some offal and some bone, and it's good to give veg as well. And it's quite hard to make your own raw food if you should want to anyway. But luckily, the last 10-15 years, there are a number of companies making ready-made raw food for dogs, well balanced, completely healthy, and also the better ones do check their food for, you know, salmonella and all the bacteria. And they normally do it in frozen packs, so it kills off most of the bacteria. So it is, whatever your vet might say, it is completely safe to give raw food. What also grieves me, I've read real go at vets, aren't I, today? They're wonderful vets, but you know, most are so anti-raw food. I just do not know why. I think because they don't understand it, and because the big pet food companies say it shouldn't be doing it. Yeah, exactly. Well, you see, the big pet food companies sponsor this and sponsor that, and Hills, one of the bigger, they actually pay for the salaries of some of the lecturers in veterinary nutrition at universities. You know, how unbiased can that be, I wonder, you know? And I think the problem is, it's true, you come out of veterinary college a bit like being brainwashed, I think. You know, I mean, in a sense, I did. I came out thinking there's just one way of doing things. But even more now, I think, with all this going on, that students are just not able to think for themselves, I think, really. You know. And sadly, a lot of vets leave practice after quite a short time in practice, quite disillusioned. The dropout rate of vets is surprisingly high, after they've qualified, I mean. And I think it's because, well, I think at veterinary college, the problem with veterinary college, you're taught by all these specialists, and often in practice, because obviously most of the veterinary college have their own hospitals and their own, but they see all the difficult cases, the ones with the high tech. They see lots of big equipment being used, MRI scans and this and that and the other, and they thought that's the only way to do it. You've got to do all these investigations. They come to general practice and not realising that most people can't afford all those treatments anyway. Also, it's often not necessary, and they're not used to the basic things like squeezing anal glands, you know. And if I'm just too uninteresting, well, nothing wrong with squeezing anal glands. I quite enjoy it, really, you know, because it makes your patient better. That's what I mean. You know, anything that makes your patient better is enjoyable for me, you know. Actually, that takes us back to the case where, again, you think outside the box sometimes. A case was referred to me. Well, when I say a case was referred to me, what I mean is the client asked to be referred. Almost no vets refer to me directly. They won't do that. But if the client asks, they will often do it. So a case came to me for a client, and it was a cat that had the most awful eczema around the base of its tail and up the spine. And it had this eczema for, I think, about 9 months. And again, had the usual thing, antibiotics, steroids, some nice creams put on, some gel, which it licked off, of course. You know, nothing was working. So I had a look, and I had a sudden thought, has this cat its anal glands squeezed ever? No. Squeeze the glands, desperately full, those glands, really full. Squeeze them out, cat was fine after that. It had been, no, the anal glands.
Oh, the anal glands.
Anal glands, yes, the bum end, yes. And the vet hadn't thought to check the glands, because mostly cats don't often get anal gland problems, but this one has. So to think about that was nothing to do with natural therapy. It's just thinking about things, you know. And again, putting the fragments together, trying to get things into context, you know. So diet, I think, is important. And some of the great successes I've had with bowel problems have been putting dogs onto a raw food diet. There's a German Shepherd dog I saw when it was about 9 months old that had since puppyhood had chronic diarrhea and was, I don't know, about 10 pounds underweight, I think, and a real weak, scrawny thing. And I'll never forget the client was so believing in me that when I said, I think the best thing to do is put this dog onto a raw food diet. And then, you know, she'd been told by her vet, don't even touch that with this problem. Went onto a raw food diet with slippery elm, of course, and some homeopathy. But the thing is, from the moment that dog started the raw food diet, the diarrhea stopped overnight. And within about 3 months, he was a great big brawny boy. And I have a photograph in my practice of him coming out of the ways with a great big tree trunk in his mouth out of the stream. And there's on the back it says, from the dog who carries trees, thank you so much. So there we are. So diet can be that important. Then I'm going to look about things like prevention. To me also means try not to put too many. What time am I finishing at, by the way? Sorry.
Well, tea break usually about 9.
Oh, that's fine. We'll rattle through. It's fine. No problem. Yeah. Prevention. Not too many chemicals. Now, I think what my other beef about my profession now is we still keep sticking chemicals into animals. You know, we give them worming doses every month or two. We give them these spot-on flea and tick treatments every month. Give them vaccinations every year. We do all these things to them. You know, I'm convinced all those things weaken the immune system. Now, I am not anti-vaccination. I do vaccinate my own dogs. But what I do is I vaccinate them later, finish later, and I don't do boosters. I don't do any boosters. There are 4 main diseases which are vaccinated for, which is distemper, hepatitis, parvovirus, and leptospirosis, or lepto for short. So 3 of those, the distemper, hepatitis and parvo, are pretty horrible, often fatal diseases, and I'm a great believer in vaccinating against those. But they're live vaccines, and what that means is that once they're in the system, although most vets give either a 2 or 3 yearly booster, they do not normally need to be repeated. You have protection for life. A lot of research has shown that 98% of dogs that have finished their vaccination course at or after 16 weeks of age are then covered for life. And you can, if you want, do blood tests to look at the antibodies as well. Now that is useful, but it isn't actually that useful, because even if there are no antibodies, that doesn't mean the dog isn't protected, because the body has memory cells, which means they memorise how to make the antibodies, and if they get disease, they can make the antibodies. So a 0 antibody level doesn't mean you don't know, of course, that's the problem. If there's an actual positive antibody titer, you know they're protected. If there isn't, they could still be protected. So a lot of confusion about what to do. My usual advice is either, as I do, just assume they're protected and just hope for the best, which is what I do, because I don't like sticking needles in my dogs. Or you can do a titer test and see if they're protected. If they're not, then choose to either do a booster or not. Now the real problem there is, supposing you do the titer for the distemper, hepatitis and parvo, and supposing your hepatitis is nice and high and your parvo is, but distemper's low, you'd say, well, let's just do distemper vaccination only, but you can't get them. They come as a trio, so you have to give the whole lot. Now, the manufacturers do make single doses, but then you sell them in about 20s, and no vet will buy a box of 20 distemper vaccines in case they might just one of them. So you're stuck giving the whole lot, which is why I don't do it. Leptospirosis is a ridiculous vaccine, because there are, I think, 28 strains of leptospirosis. It's a bacterial disease, so it is actually treatable with antibiotics or with homoeopathy. And if you catch it reasonably quickly, it's perfectly treatable. The vaccine, there's 2 main vaccines. One's called the L2 because it covers 2 strains out of 28. And the other one's called the L4 strain, which covers 4 strains out of 28, except that in this country, one of those 4 strains doesn't occur anyway. So it covers 3 strains. And that L4 has definitely been causing a lot of adverse effects in dogs. And leptospirosis vaccination itself is more often associated with side effects than any other vaccine. And because that's a dead vaccine, it doesn't last more than probably 10 or 12 months anyway. So most vets are saying give that every year. No, I just wouldn't do that. The risk factor in picking up lepto is so tiny, I believe, that I don't tend to do it. But obviously this is, a lot of my clients are stuck between what I suggest and what their own vet suggests, and you have to find your own way through, I think, in that. But I do see a lot of disease, and going back to this never well since syndrome, where you look back at, say, when the first fit occurred, it was about 2 or 3 weeks after the vaccination, or even the next day in some cases. So I'm convinced that vaccination can trigger disease, and certainly repeated vaccination, I'm sure, does cause disease. So the fewer vaccines, the better. We should be probably vaccinating more dogs, but less often, if that makes sense. Because in a sense, if all dogs had their puppy vaccinations, then there'd be less risk of any of them picking up disease.
Richard, one of the things you mentioned earlier, right at the start, the skull cap and valerian.
Oh yes.
For anxiety.
Yes. Do you need some?
Our dog has several anxieties. Probably takes after its owners.
Well, they do say. I'll come back in a minute. Yes, go on.
Fireworks, you mentioned, classic.
Yes.
Loud noises, classic.
Yes.
She barks at lorries, buses all the time. She basically has separation anxiety and got a doctor tonight. That's all by the by. What I wanted to ask you is, are you going to tell us how to get these? Does one have to come to you? Could you get them online?
Yeah, you could get them.
Do you know how much dosage to give, etc., etc.?
Well, that's good. Skull cap and valerian, yes, I do stock it, but there is a company called Door West, and Door West do a whole range of herbs for pets, and they have dose rates and everything's straightforward. GORW, Door West, yeah. Yes, they'll do dose, yes, they come with dose rates on. Great. Yeah, absolutely.
The other thing I want to mention is that you talked about never well since being so important. We've got a rescue dog. How the hell do you know what it was like?
You don't know.
It started
There are gaps, and of course the other thing, you can't ask them questions directly as well. You know, I think all you can say is there's obviously been trauma in the past. Look at treatments of trauma. You don't know precise traumas, but again, you know, you use things like aconite maybe or other remedies like that. But there are chunks you can't find with dogs sometimes. Yes. That's very true, and there's bits missing which you have to either guess or just say, well, you just don't know.
And sorry, the third one, and I'll shut up then. This is somewhat controversial. I'm assuming that with your practice, insurance companies won't cover you.
No, that's not true. They do.
That's good.
Yeah, interesting. Most pet insurance companies do cover natural therapies. It may be a lower cover, but they do. Yes. In fact, Sue, who works in my practice and is my practice manager, senior receptionist, she does all the insurance claims, and she has dozens and dozens every week to fill in. So companies like Pet Plan, Animal Friends, Sainsbury's, they do cover. Yeah. Pet Plan are quite good actually covering, but all they do. So, whereas with human medical insurance, very very rarely do they cover it. So we're quite lucky, really. Yes. So where was I?
You cover acupuncture for people as well.
Yes. I think yes. That's true. Yes. HSA, for instance. Yeah, HSA do that. That's true. Yeah. Yes. Oh, yeah. We don't. We'll leave it right there for the moment. As we've got vaccination, we've done. Neutering is a great interest in neutering. What about neutering? My default position, basically, cats, there's not much choice about it, unfortunately, really, for them. You know, you can't have an unneutered tomcat. If you have an unneutered female cat, they're going to go pregnant all the time. Really, there's not much choice about it. They've got to be neutered, you know. Dogs is a bit different. Now, I keep knocking vets, don't I? But vets will say, you must have your dog neutered, male or female, because, you know, they'll have puppies, or they'll make the dog pregnant, and it'll stop them getting mammary tumours if you do if they're female, and so on and so forth. Most of that's just rubbish, basically. There is, and interesting, in the US and the UK, neutering is not only common, but almost pushed, and often very, very young age as well. The rest of the world, like Scandinavia, Europe, it's not done at all. It's just not done. You don't take healthy organs out of animals. Just leave them alone. You know. I think in fact, in Sweden until recently, it was actually legal to neuter a bitch unless there's medical reason to do so, because you're basically mutilating, aren't you? You take out healthy organs. Now, I'm not against neutering per se as such, but what I do think is that vets should be honest and give you both the pros and the cons. Now, male dogs, it's very straightforward. If you don't neuter, the only real possible problem is they can get enlarged prostates when they're older, which is quite treatable, to be honest. But interestingly, neutered male dogs, if they get prostate problems, are more likely to get malignant prostate tumours than entire dogs. So it's odd, really.
Well, you could tell the other way around.
No, it's not true. No, neutered dogs do not get general prostate enlargement, but they're less likely to get prostate tumours.
Yes.
Interesting. Whereas it's said it will often control behavioural problems. Neutering very rarely stops behavioural problems. Most things like aggression or overexcitement are brain-driven, not hormone-driven in male dogs. So there's not much of a cause or case for neutering for behavioural problems, except in the very rare cases. So male dogs, okay, if dogs are becoming a real nuisance, or you have a male and a female dog, you may have to think about it, but I wouldn't routinely neuter a male dog. The other possible problem is testicular tumours, which are quite unusual in dogs, and they're almost always benign anyway, so it's not a great reason for neutering. And the worst thing is early neutering in both males and females, because early neutering can often lead to bone and joint problems, because if you neuter too early, it stops the bones developing properly. They tend to overgrow. You get too long a bone, and they're weaker. And early neutering makes it more likely a dog will get cruciate ligament problems or other joint problems as well. So if you have to neuter, leave it at least fully grown or a bit older. Now, females it's a vexed question indeed. So why would or wouldn't you neuter? Well, obviously, if you have a female dog, they'll come in season, and you've got to make sure they don't get out and get mated. And it's a bit of a pain, but it's only twice a year. and it's more of a nuisance than a problem in my view. So vets will, well, they'll get mammary tumours if you don't have them spayed. Now, there's a lot of research that shows that's actually not really proven. But what is proven is, if you neuter a dog and they do get mammary tumours, still, they're more likely to be malignant. Whereas if you have an entire bitch who's not been neutered and they do get mammary tumours, they're going to stay benign almost certainly. So, because I mean, I don't normally neuter my female dogs, and 2 or 3 have had little mammary growths. I've just left them, done nothing, they've just got a little bit bigger and nothing's happened. They've been completely benign. But my guess, if I had them neutered first, they probably would have been malignant. Then most vets don't mention that there's quite a high proportion of neutered female dogs that get urinary incontinence when they're older. And the treatment for that, or one of the treatments, is to give HRT basically, it gives the moisture back again. So didn't do it in the first place. And neutered dogs are more likely to get some tumours. Bone tumours are more common in neutered dogs. And other hormone conditions like thyroid conditions, adrenal problems, seem to be more common in neutered dogs as well. So while there are some, now true, if you don't neuter, yes, you might get mammary tumours, but they might be benign. There is a condition called pyometra, where there's an infection and gets into the uterus, which only happens in dogs that obviously haven't been neutered. That again is, you can operate for that, but it is a possible downside. So you have to weigh up all these pros and cons. I mean, that's fine, but most vets don't mention both sides of the argument, and they do pressure you to neuter as well. And of course, there's the anaesthetic risk. I mean, even in young, healthy dogs, there's still a risk in anaesthetics. So all I would say is, think about it, but don't take your vet's word for it. And I'll finish quickly with parasites. I love parasites. Parasites are great, aren't they? They're so fascinating, parasites. Did you know, by the way, that thing I said about IBD and colitis and Crohn's is so common in the Western world? One of the reasons why it's very uncommon in the so-called third world is because a lot of people have parasites in the digestion tract. Those parasites protect against IBD and colitis and Crohn's. Just one of those strange things. It's not that bad to have a few parasites, should you want to have them. In fact, there is a treatment now in this country where they will actually give you sterilised parasites as part of the treatment, and that can be quite successful. So, worms are fascinating. Worms are absolutely fascinating. One thing that GPs often get wrong is if a child has threadworms, get that itchy bottom that children get, they say, it's from the dog. In fact, they're not. The dogs don't get. They get different worms. They're not at all. So GPs often get things wrong. GPs get lots of things wrong, don't they? Yes. If I meet GPs, I say, you've got such an easy life being a GP, haven't you? What do you mean? Well, you have one single species to deal with, one, the human. We have dogs, cats, guinea pigs, rabbits, farm, and also your patients can actually talk to you, give you details, ask, can't you? And also GP in practice, well, they do nothing at all. Whereas vets, we're GPs, obviously, but we're also surgeons, anaesthetists, radiologists, pharmacists, dentists, do the whole lot. Yeah. Oh, what an easy life. And interestingly, actually, a lot of vets, a lot of doctors are failed vets. What I mean is, they're the ones that couldn't get the grades to get into veterinary college, and they go to medical school instead. It's much easier getting into medical school, grade-wise, than it is going to veterinary college. There we are. So, parasites quickly. Puppies need to be wormed. Yes, they do. The reason puppies often have worms, always have worms, is that the life cycle of roundworms is fascinating. If an adult female dog gets infected with roundworms, the eggs hatch out in the digestive tract. They burrow through into the insides, and some of them stay in suspended animation until that bitch gets pregnant. Then they track into the uterus, into the embryo of the puppies. So they're born with worms. And worming doses kill what's in the intestines, but not what's in the body. It's always impossible to eradicate worms because of that reason. So puppies need worming, absolutely so, conventional wormers. Once they're over about 9 months of age, mostly you don't need to worm ever again. Now your vet will say otherwise, of course, but what you can do, and I think what should be done, rather than give a worming dose, is to do a worm count, a worm egg count. And what you do is you take some dog poo. I don't mean you. There are labs that do this. Take some dog poo. There's a lovely online lab called wormcount.com, and wormcount.com. If you go there, they'll send you a little plastic pot. You put your dog poo in, then off them. They'll look for worm eggs. So you'll know if there are any worm eggs there, and also if there are, what they are and what you need to give worming doses against. Is that more logical than just giving a worming dose anyway? Instead. And I think, again, in Denmark, I think it's illegal, I think, to prescribe wormers for a dog without doing a fecal egg count. They're worried about resistance building up. It's happening in cattle and horses already. They're wormed so often, they're getting resistant, a lot of the wormers. That will happen in dogs sooner or later as well. So why not just do a worm count instead?
What about cats?
Yeah, same with cats. Same principle, yeah. Yes, and wormcount.com will also look for things like Giardia, which is quite a common parasite in dogs as well, so you'll know what's there. And I know the company quite well. It's quite a small company, and they're really passionate about what they do, looking at. And I said to them, I feel sorry for your postman. I said, yes, he knows what's in there, he doesn't mind. It's fine, you know. But imagine, you know, oh, what do you do for a job? I look at dog poo all day long. Well, really, that's interesting, you know. But they're a great company, and they are so passionate about getting it right. And they get so much flack from vets who say, you're taking our business away from us by doing this, you know. And then flea and tick treatment is the next thing, isn't it? All these spot-ons, you know, you give Advocate and all this stuff, you know. A lot of those contain neonicotinoids, which are the stuff that's killing all the bees and so on. And it's washing off the dogs into the streams, and it's killing all the insects, you know. So why would you give a chemical like that, which I see a lot of dogs that have skin reactions to it, and I'm sure it weakens the immune system. My dogs at home, I've never given them a flea or tick treatment in their lives. So far, touch wood, I've never seen a flea or tick on them. Now, what I do, when they've been out for a walk, I look very carefully and make sure there's no signs of ticks. If you do find a tick, there's a thing called a little tick hook, which your pet shop will sell you, and you can get a tick, because you get a tick off in the first 24 hours, it won't pass on disease. So treatment, just to make sure. It's not the occasional use that's the problem, I think it's the really frequent use. So that's a quick run through.
Should you use the Advocate twice a year?
I would say just a couple of times during the high summer, yeah. I mean, it depends on the risk factor and if your dog's had ticks or fleas before or so on and so forth. Certainly if you have cats and dogs, that's a bit of a problem, because cats often have fleas.
And what about lungworm?
Well, lungworm is a parasite that gets in the intestines first, so when you use a company like wormcount.com, they'll look for lungworm as well. So they'll check for that too. And again, there's if it's present, you can give a worm for that particularly. You have to do 3 daily samples, rather than just one single sample. 3 daily fecal samples. So basically, you have a pottage, you put a bit in each day, next day and third day, and then send it off. So you have a bit of poo hanging around, but it's still worthwhile doing.
So does the spot affect the homoeopathic treatment? I mean, so I'm just...
The jury's out on that. It used to be thought that homeopathic pills are affected by lots of things, like garlic and so on and so forth. I still officially say better not to give garlic, but it seems that it's not that much of a problem. And I find a lot of dogs and cats who have homeopathy, whatever else they're having, any other treatment, it seems to work. Steroids, I think, do depress the effectiveness a little bit. But even with dogs and cats on long-term steroids, I have good results still. So I think homeopathy can work to anything pretty well.
Can you, what you said about flea treatment, I mean, would fleas and ticks not be more common in a dog like ours, which she's really hairy, and therefore we give her
Not particularly. Fleas don't seem to mind length of fur or anything really. But a little look. Well, what you can, if you comb through onto a sheet of white paper, right? That's pretty sharp paper. Comb right through. If there's fleas, there'll be flea droppings. Now, fleas being bloodsuckers just pass out dry blood. So you get little black droppings, and if you moisten them, they turn red. So that's if I know. Yeah. Yes, there we are. Yes. So that's a quick run through. I'll just come to a grinding halt there, I think, and then when we've had a bit of a break, I'll take some questions.
I just wondered whether you treat a lot of behaviour problems.
More and more, yes, more and more.
Is it often related to the owners?
Almost always. Well, no, that's not true. I should say almost always, but certainly in rescue dogs, it's a problem they come with. Otherwise, mainly owners, yes, treat the owner rather than the dog. And I'm using things like cannabis oil more and more, CBD oil more and more, not just for behaviour problems, but for things like pain relief and. Apart from the things I mentioned, there's so many other natural treatments. I'll come back next year and talk about them maybe.
I just have one question.
Yes.
Do you ever work with horses or big animals?
If you listen, I don't treat things bigger than me. Oh, no.
Sorry, because I was going to ask what would you say is the ideal diet, because traditionally we always give like grains and
well, horses are, yes. I would say, yes, natural diets are the important thing. As close to the natural diets. But horses being herbivores, it's mainly, if they could be grass-fed, that'd be the ideal. Grass and hay, really. But they need, exactly. But they will be eating some things as well. But try and give us few.
Grains.
Yeah, I don't think it's wrong to ever give grains, but I think the less the better, really. Same with rabbits. Rabbits should not be eating this muesli stuff. They should be eating just grass and hay and a bit of buttercup and so on as well, So try and keep it to as close as what they would eat in the wild as well. But say that's not my area, big animals. They're just too much for me.
Is that skunk and valerian together?
Yeah, together.
Oh, it's together?
Yes, it's in a combination, yeah. Mm.
Okay, and you think it'd be good for anxiety and...
It will. I wouldn't say on its own it's going to solve the problem of a rescue dog with that level of problem, but it might take the level down a bit. And maybe some CBD as well.
Yeah, you can't. We know from humans we can't get CBD just like that.
Okay, easy. I mean, it's yeah. Well, anywhere.
I wonder if Jill's got it in her shop.
Yeah.
Without the DHC. Without the DHC.
There's a weird thing about CBD, by the way, is that our governing body on medicines, the Veterinary Medicines Directorate, has decided that CBD oil is a medicine. And if it's a medicine in the veterinary world, you should use a licensed veterinary version. So they're saying is you cannot use CBD unless you use a licensed veterinary. Well, there isn't one, because to get a license is so difficult. But there's something called a cascade system in veterinary, where if there isn't a licensed veterinary product, you're allowed to use a human equivalent. So officially, legally, officially, only a vet can prescribe CBD because it's a veterinary medicine. There isn't a veterinary vet they can prescribe a human CBD, but nobody else should really be getting CBD for their pets. Now, who's going to police that? I mean, it's ridiculous, But that's the official position. But yes, CBD is all over the place. You can't escape the stuff. It's everywhere. It is without the hallucinogens. Yeah. I do have some clients who are using it, using the real stuff, by the way. But I don't ask questions about that. And it can be much more effective as well. Yeah. And of course, in Canada, in many states, the US, it's available now. My youngest son was out in Canada recently. He couldn't escape cannabis all over the place. Yeah.
Sorry, I just saw a program recently on television, and actually it was a very, very short report where a whole series of CBD oils had been tested. And the strains that were mentioned on the bottle, when didn't compare in any way with...
This is going back to the Chinese. I'm sure this is it. And I didn't stock it for a long time myself. I just wasn't sure about Silver. I now use a company I trust implicitly. They are really good. I know they've had it all tested and it is good stuff. But you have to be very careful. There's some very, very cheap CBD oils out there, and I don't believe they can be really full strength or... No, they're quite so. Yeah, I'm sure it's the case. So
10 or 12 makers or whatever.
Yeah, I'm sure that's the case. Anything that looks too cheap often is too cheap, basically.
Which company do you use?
They're called Canawell. Canawell, C-A-N-N-A, Canawell. And they do a balanced one with all the whole range. So there's different CBD, there's CBD-A and CBD-B and C, and that's got the whole range in there, and I thought that's pretty good.
And how do, sorry if this has already been asked, but as regards to acupuncture, how do the dogs or cats react? I mean, do they, when you put the needle in, you start the needle, do they stay calm?
Yeah, they are, yes, if you arrive on time. I shouldn't be rude to no, it's like, honestly, don't worry. I once went to a concert given by a folk singer called Jake Thackeray. Remember Jake Thackeray? Great guy. And he was in the Stevenage Leisure Centre. And it's quite a big theatre there, so we went in there, we sat down. Anyway, somebody came in late, and he stopped singing, and he said, "You're late." And he said, "I'm so sorry. I used to be a teacher," he said, "I can't help myself." So I didn't mean to be rude, sorry, yeah. No, absolutely fine. Most dogs, and even most cats, are absolutely surprisingly fine. They mostly stand or sit there, and they're really good about it. Yeah. Fine. Should we break? I'll break then, fine.
Okay, guys, the kitchen. So back to we've got till 10:15 at the latest, really.
Fine,
so
yes, whatever.
Time
Yes.
for your questions and answers, and over to you guys.
Fine. I shall stay sitting now, I think, now, because my old bones don't cope with something for too long. Is that okay? Yeah? Fine. Okay, so I'll take my ease while you ask the questions. Yes?
Can I just ask about that controversy a few years back, or perhaps even longer, where the Royal Vet College wanted to strike off vets who practice homeopathy, and you responded, I think, in the Dogs Monthly magazine with what I thought was a brilliant article, because your tone was very gently correcting their fallacies and ending on a humorous note, which I thought was better than just immediately engaging in them when they don't want to listen. So.
It's a good point. It's actually there's two organised. There's the Royal Veterinary College and there's the Royal College of Veterinary Surgeons, who are quite distinct. The Royal Veterinary College is a college that trains vets, which is why I went to, but that they are not the governing body. The governing body is the Royal College of Veterinary Surgeons. Understandable mistake, but yeah, RCVS. So you see, there is a small number of vets who are very anti-homeopathy. And unfortunately, one of the number managed to get onto the ruling council of the RCVS, and began to push for vets to be stopped using homeopathy. So huge discussions went on, and they came out with a statement not to say that vets could not use homeopathy, not quite there, but they said that it should only be used in conjunction with conventional treatment or after conventional has been tried first. And we were pretty angry about that because, I mean, obviously I just use homeopathy and some vets do. So at the moment, it's a bit of a sort of standoff, but that's the position that we are not supposed to be prescribing homeopathic treatment unless the patient's already had conventional treatment or is on it. It doesn't affect me personally because as I work in referral practice, all my patients already had conventional treatment when they see me. But other vets who are in general practice, it's a bit different. So that's where we are, and we're still fighting to get that changed, but it's a bit stuck in aspic at the moment.
Is it just homeopathy they're against?
That's really all they seem to be against. I mean, I think there seems to be a reasonable acceptance of acupuncture, because other treatments I use much more rare. They seem to forget about those. It's just and also with herbs you can sort of prove an action, and there is some body, but homeopathy, because so far we can't prove how it works, that's why they are saying, well, it can't be scientific, whatever that means. So that's the position. So we're allowed to use it, but there are supposed to be limits. I don't think anyone's going by the rules, to be honest. If somebody decides to bring a case against a vet, we'll see what happens, but it hasn't happened as yet. But that's where we are.
And that person's still on the governing council?
He is, but I think you go on for 3 years and you come off, and I think he's coming off this year. Interesting. He also put up as an MP. He was going to be the Liberal candidate for somewhere in Somerset, but he didn't get anyway. There we are. Yes. Yes, you had a question.
Yeah, actually, it's an interesting point in as much as that the veterinary world seems to be going along similar lines to the medical profession, and they're also trying to prevent homeopathy from being used in the NHS.
Yes.
They're not against acupuncture.
Same principle, yeah.
But homeopathy is now, it's a total known, almost a total known.
Yeah.
And even in the same way as diet in dogs or cats, doctors and professionals in the medical world have very little knowledge or care about diet.
Yes.
And all of us here, I'm pretty sure,
They do
agree.
about 5
Yes,
hours
absolutely, yes.
of diet.
Yeah, they just
They don't cover nutrition.
Yes, there's a very strong parallel in all these areas, particularly nutrition, where most vets have no knowledge of nutrition at all. They just do what the pet companies tell them to do, which is very sad, I think, really. But I think interesting. Go back to homeopathy. The Australian government commissioned a report on homeopathy because they were trying to ban it, and the first report that they produced actually came out, and looking at all the scientific evidence, came out saying that basically, yes, there's something in it. They suppressed that, and they started a second report, which came out the other way. But there's been a huge legal case, and they've been made to now publish that first report. So, and of course, homeopathy is very strong in some. India there's a huge number of homeopaths and uses, and on the continent still as well. So it is very strong in some countries, but sadly less so in here at the moment. But yes, there's a strong push by all the medical professions against homeopathy. It's very hard to sort of stand up to them, really. But yeah, we'll see.
No, it's just an interesting parallel.
Yes, absolutely. Yeah. Oh, is it? Yeah, the very strong parallels. Yeah. Yes.
Is there something you'd use instead of this spot on flea treatment?
There are flea and tick repellents. They're not so much going to kill fleas or ticks, but they make the animal more hostile. Where I work, we have got like a natural spot on, and it does help. I mean, I think if there's huge numbers of fleas and ticks around, it probably won't be enough. And there's various natural anti-parasitic products. It's been called diatomaceous earth, DE. You know that? Yeah, that's it's made from powdered. I think it's from some ancient insect life, and it basically kills the fleas by desiccating. It dries them out. In fact, there's also we've got a spray for use around the house, which is silicone based, and that again desiccates fleas and ticks and so on. That can work, but I don't think you can rely on anything natural completely if there's a huge number of fleas and ticks around. Interesting, most fleas are cat fleas, even on dogs. Most fleas are host specific, so dog fleas live on dogs, hedgehog fleas live on hedgehogs, and they won't transmit across. But cat fleas live on anything warm-blooded. So most fleas found on dogs are actually cat fleas.
Oh, really?
Yeah. And people say, my dog's got fleas. Yeah, my dog got fleas from a hedgehog. No, if the dog's got fleas from a hedgehog, that was cat fleas as well. It wouldn't be hedgehog fleas. So we are. So if you have cats, unfortunately, they are very prone to fleas.
What about lungworm? Is there something natural for lungworm?
Yes, I mean, you can use things like garlic even, actually, in low dose. Yeah, garlic. But again, I think it's more repellent. And I would still say that doing something like the worm count I mentioned to look for lungworm might be worthwhile sometimes to make sure. But also, you see, lungworm is only picked up by dogs that eat slugs or snails. Lungworm is a two-host parasite. So basically, if a dog swallows a lungworm egg, it won't get lungworm. It has to live in a slug or a snail first, and then the dog has to eat the slug or the snail. So if your dog doesn't eat slugs or snails, it won't get lungworm. And there's been huge sort of, misinformation. I mean, lungworm is still quite a rare condition. It's not a common problem in dogs, but one of the big pharmaceutical companies got a license to use their product, to sell the product as treating lungworm. They got this huge advertising campaign going, your dog's at danger of lungworm, take our product right away, whereas in fact, yes, there is a risk, but not a large risk.
Sorry to keep talking, but it's very frightening when you go into a large veterinary surgery and you have these massive posters warning you about the dangers of lungworm.
Yes.
You've got this little creature you've brought in with you and you're so concerned for its welfare.
Absolutely, yeah.
You think, well, maybe I should give it that.
I do think vets love to frighten you, don't they? And give you worst case scenarios as well. I think the biggest risk, to be honest, in this country is rabies, because there are a huge number of puppies coming in from abroad, many with falsified certificates, many of which could be carrying rabies. And I'm not in favour of going back to quarantine as such, but I do think we're allowing far too many dogs coming into the country, and it should be the case that they are much older when they come in first anyway, and it will happen at some point, I'm sure. Interesting, did you know that bats can carry rabies? And there's a species of bat called Dorbenton's bat, which I think up in Scotland is quite common. That has given a couple of people rabies. Just a little side there. Yeah, but I think that's a far bigger risk than lungworm, in fact, really.
Richard, my dog, every time we go for a walk, he'll dig in the mud and eat some of the soil. Do you think it's because he's lacking something?
That's a really good question. I get asked that a lot. My dog often goes to a particular place to eat, or something like that, and rarely, I think, is it due to a mineral deficiency. They just like the taste, I think.
He'll never do it once on a walk, and it's only a small amount, and it's never the top. He'll dig in and then have a few mouthfuls, and then
yeah. I think that there's just they are scavengers by nature. They will eat roots and berries and so on. Maybe they just feel a need to eat it, but I don't think it often means there's any sort of dietary problem. They just enjoy it.
What, like eating grass?
Yeah, indeed, yeah. Or eating other dog poo or something like that, I mean, dogs are quite horrible in their habits, really, aren't they? There are so many dogs, but they are scavengers by nature. That's what they do in the wild. They eat any old rubbish they come across, really. Luckily, they have a very good vomit reflex, in the sense that if they often they just bring it back up again. And we humans, it's so hard to be sick, isn't it? We don't want to be, we do anything not to be sick. Dogs and cats, bring it back up again. Why waste it? And they'll eat it again then, of course, as well, and it's different. You see, a dog's digestion is so different from ours. I mean, this is why I think they are basically carnivores. They have a very distensible stomach. They eat a large amount at one time, and when we eat, we have an enzyme in our saliva that starts to digest the food, and that breaks down starches. They don't have that enzyme, so they can't digest starch so well. So it goes in the stomach, and in humans, it doesn't stay long in it. It just gets churned, and it goes on to the next stage. In dogs, it stays a long time in the stomach because that's where the acids start to dissolve the bone or the meat, and that's where a lot of digestion happens. It goes through the digestive tract and then comes out, but it takes a long time in the stomach, because often dog will bring up something a day, it's actually been eaten, it's been there all the time. It's quite remarkable. And they're quite a short digestive tract compared with ours, because it happens mainly in that stomach. What else do you want to know then?
Can I just ask you, what is your theory about why dogs roll in poo? Fox poo or any poo?
There's a lot of work being done on that, and no one knows for sure.
Or dead animals.
Yeah, dead animals, yeah. You see, there was one theory that it is to disguise their own scent, but no one has quite proven that, really,
Testing our love, I think.
Well, because interestingly, I used to have a golden retriever who rolled specifically around the scent glands. I now have a foxhound, and he has never done it, but he's 10 years old now. I got him from Southbridge as a rescue at 4.5 months. He came over from a puppy farm in Ireland, and I think, obviously, he's a hound. I have lost him so many times going off on a scent. But that's what he's interested in. He doesn't care what's at the end. It's the scent. That's what drives him crazy. Whereas I think my golden retriever was disguising herself, her scent, for when she went out on the hunt to catch something later. She didn't remember that her food came from the cupboard in the kitchen. In her mind, she was going out to catch something later, so she had to disguise herself
But then you see, why would you want something like a fox who's also a predator? Doesn't really make sense, you see. Yeah. I mean, I think it makes sense. It doesn't make definite sense.
No.
It could be. It could be. But there are things we know we don't know, and that's one of them. We don't know why for sure. Yeah, we just know why.
I'm very pleased to say he doesn't do it.
No, good. There's also somebody wanted a PhD project on male dogs, and when they pee against a lamppost or a tree, the height they put their legs up at. And what they found was that small dogs lift their legs higher than big dogs, because that means that the higher the pee is, that the bigger you think the dog is. So other dogs going by think they're bigger dogs. So yeah. So I thought, imagine that as your PhD project, though. They filming dogs peeing for about a year and a half. You know.
Psychology.
Yeah, must say. But it is. There's weird things that do come up, and we don't know about really. Yeah. You had a question? Yes.
Yes, sorry. My 5-year-old dog has been diagnosed with having long-term food allergy, had a stomach biopsy, and that's the result that came back. So he's on hypoallergenic food now. But he has a problem with reflux, and for that he's taking a human drug, also
Omeprazole? Omeprazole, yeah. Yes.
And I just wondered whether there's any kind of equivalent that's natural that he could actually take. It's not all the time, it's just he has a problem.
Yeah, if you look at the possible side effects of omeprazole, well, I wouldn't actually, because you worry too much. Yeah, I wouldn't mind betting if you put him on a raw food diet, he'd be okay. And interestingly, you see, the food allergy is often to the processed protein and not to the raw protein, because obviously when you cook protein, it denatures it. It's different. And I've known quite a few dogs with supposed food allergies that on a raw food diet had no reflux and were absolutely fine. Now, I can't guarantee that, but it might. And again, slippery elm, fantastic. That's good for reflux.
Okay.
Be worth thinking about. Yeah.
When you say raw food, one of the things that they did say to me was that in most cases it is chicken that dogs seem to be allergic to.
Yeah.
I just wonder what other raw food would perhaps be more sensible to try.
Yeah, I mean, the company that I use for my dog, they do raw food which has a chicken variety, a lamb variety, a pork variety, a duck variety. So there's lots of different things. You don't have to. Chicken, interesting, years ago, chicken was the go-to food with dog with upsets and digestion. Now it seems it's more likely to be a problem. It's the way they raise chickens, I think, more than anything else, really. You know. Yeah.
Could you just remind me of the name of your supplier?
Oh, they're called Honey's Real Food for Dogs.
Honey's Real Food, as in honey like bee honey.
As in honey, because their dog's name was Honey. Yeah, that's right. Yeah.
Thank you very much.
I like them. I mean, there's some other very good other foods are available, but they're very ethical. They make sure that the animals that are used are really high welfare standards, slaughtered as close to the farm as possible. They check their food regularly for salmonella and all the other bugs as well. And they're a nice small company. They don't want to get big either. And the other thing good, they have a very good helpline, and they're happy to give advice even if you don't buy their food, because they're so passionate about raw feeding. Yeah.
Okay, thank you very much.
Just a thought. Yeah.
I know that in humans, I don't know about in animals, but the PPI, ranitidine, it renders the gastric juice alkaline, so it interferes with absorption.
Well, yes, and so the problem is that dogs need a high acid content. Yeah, yeah.
It needs to be an acidic environment.
Absolutely, yeah. Yeah.
And also it interferes with a lot of your B complex vitamins absorption, notably vitamin B12, and also iron absorption. So it's not good. Actually, that drug should not be prescribed longer than 6 weeks.
Yeah, it's not supposed to give them for too long, right? Yeah, and you see, dogs and cats have a much higher pH acid in their stomach than we do, because they have to dissolve bones and so on. As we know, cats will eat birds and eat the feathers and the bones and so on and dissolve them. So if you're knocking out that pH, that acid, bringing it down, they won't digest the food properly. So it's a knock-on effect, you know. Yeah.
Below 2.5.
But there's so many drugs that are used, like omeprazole, which really are not even licensed for veterinary use, but there isn't an equivalent that are used. And if you look at the list of possible side effects, particularly with long-term use, it's awful. Yeah.
Yes, that did say to me that it can cause stomach cancer and things like that. But
yes, have this drug and cause stomach cancer. Yes, that's right. You know.
it's difficult in the short term. You're thinking, well, I've got to cure the problem, I've got to do.
Yes, I mean, again, I'm not against ever giving small, or you could use just any ordinary antacid anyway, But there are, I mean, slippery elm is hugely helpful, and there are some homeopathic remedies as well that might help. But again, it's such a complicated problem that you need to sort of look in depth about that. But yeah.
So if I did ask for a referral from the vet to you, could you give us some idea of just how much it would be just to see you for an appointment?
Right, so if you go on my website, it's all on there.
Oh, right, okay.
Yeah.
Thank you.
Yeah.
Could I ask you?
You ask anything you want.
Is there a way of not having a dog have a dental in its lifetime?
Well, raw food and eating bones.
Yeah, I do. Well, they do.
Absolutely, yeah.
Is there any particular?
I mean, again, the problem is that, yes, I mean, definitely raw food diet and particularly gnawing on bones is the best way. But also brushing teeth as well,
Not just eating a bone.
No, gnawing on a bone, yeah.
You mean like a bone to gnaw?
Yeah.
Any particular time?
Good old marrow bones, fine, Must be raw, by the way, must be raw, not cooked. But what it was, he said the problem is that we have changed so many breeds that some of them, the small breeds, have teeth very crammed together, and they're more prone to get dental problems that way. So unfortunately, you can't, even if you give the best diet in the world, if you brush their teeth regularly. I'm all for brushing teeth, but I don't brush my own dog's teeth, I must admit, but it's good to. There are still some dogs, it's also partly genetic. Some dogs are just born to have bad teeth, I'm afraid, But the problem with dogs is you can't do any dental work without knocking them out. That's the trouble. Yeah. But you'll have fewer problems if dogs are, chewing or gnawing on bones, and if you can brush their teeth a bit as well. Tim, yes.
Richard, you mentioned the therapies that you've gone through. You haven't mentioned healing at all. I'd be very interested to know your experience.
I hardly started, yes.
Etc.
Yes, well, Charles, yeah. Charles was a healer at my practice for, I don't know, many years back. I think he started back in the early 90s, I think. And Charles was fantastic. He was particularly with horses, actually, but with all animals and people as well. And he always said to me that he used to know a vet called Buster Lloyd-Jones, who was a well-known herbal vet many decades ago. And Buster died, and Buster came to him to help him heal. Very sadly, Charles died a few years ago, many years ago now. And our president here was called Helen. Helen used to work with Charles, not as a healer, but she used to do his financial work for him. But she is a natural healer, and she now says that Charles comes to her and helps her heal. And Helen is absolutely amazing. She's also a bit of a psychic. Some years ago, we had a phone call at the practice. I was on a holiday at the time, I was away, and this person said, I've got this dog with a horrible skin problem. It's sort of under its stomach and on its feet. It's just horrible. It's awful eczema all the time. Can't get rid of it. And my receptionist said, well, Richard's away at the moment, but, when you come back, but I'll perhaps ask Helen, our healer. Yeah, well, fine. So she went to see Helen, and Helen said, that's all she knew. Helen said, tell her I think it's probably to do with the lime in the roadworks outside her house. So Sue goes back to the phone and says, so the strange question, have you got roadworks outside your house? Oh, yeah, been for months, and there's all this horrible lime stuff around everywhere. There you are. That's fine. Wow. And Helen often does distant healing as well. You think, well, how can it works as well? So Helen is quite frightening. We call it Spooky Helen, actually.
I actually go with a group of healers to treat horses.
Yes.
They actually do it like much more seriously. I just tag along myself.
Yeah. Helen once, I had this dog as a referral, and he had this chronic vomiting, chronic reflux vomiting. Been here for about 3 months. And I'd seen this dog, and I put it on some anyway, she saw Helen as well, and Helen said, I'm picking up it's got something stuck in its throat. So she said, it's been x-rayed, didn't show anything up at all. I'm sure it's got something. Anyway, it didn't get any better, so it was referred to a specialist who did an MRI scan, had a piece of wood which had gone through the esophagus inside the tissues, because wood doesn't show on x-rays. It's removed, but Helen could see it was there. Spooky Helen.
So does she work routinely with most of your customers? Or?
Yeah, but the problem with Helen, it's very annoying, she's moved to Lincolnshire. So she still comes, but only once every 2 weeks. Very busy when she comes in 2 weeks. So she does, and she treats again both animals and people as well. So the day she comes, she is very, very busy indeed, yes. But yeah, she helps a lot with both animals and the clients.
The follow-on to that is, do you know of other vets that are using healers in their practice? Because obviously I'm interested in amalgamating healing into medical practice.
Very few, if any.
Right.
Very few. Yeah. I mean, the idea I have is, which I'm beginning in some ways, I quite like to have an integrated practice with animals and treating people as well. So Helen does it, but we actually, because I have 2 consulting rooms, one of which is mainly not used, but we've got a very good craniosacral therapist for people, I mean. And so I'm hoping eventually to build up the human side as well. So, one stop for you and your pet, that's fine. But going back to vets, very, very few vets have any interest in or any acceptance of, well, homeopathy, but even of healing even more. Or, which doctor is healing, so very rare, unfortunately.
And it's part of the MFSH code that if you see an animal, you have to also refer it to a vet. You can't just heal an animal. It has to also be seen by the vet.
Yes. And going back to animals and people, what I do find so often is the problem the pet comes with, somebody else in the family's got the same problem. I mean, not just occasionally, but time and time and time again. The dog's hypothyroid, somebody else in the family's hypothyroid. Dog's got skin trouble, child's got psoriasis. Time again. I mean, that is creepy. That is very spooky. But actually it's not, because in a sense, our pets just become part of us, don't they? We're in the same energy field, aren't we? They're going to get the same kind of problems as we are. Or reflect our problems back to us, maybe.
Yes.
Sorry, yeah.
How about with animal communication? Do you work on that side of things, such as telling us in touch? Or
Yeah, I have a very good friend called P. Horsley. And P. Horsley's both been a client of mine with her animals, but she does communication. And she's seen a lot of my patients and told me a lot about them as well. Yeah. And she's amazing. Even more spooky. Life is spooky.
Stories have you heard about animals telling?
Well, she was a dog once that we couldn't work out why it seemed afraid to eat, and she said apparently one time it was eating, the alarm went off in the house, and the alarm went off in the house. A false alarm went off in the house. And ever since then, it just was frightened to eat. So we had a desensitisation of that as well. Yeah. So things like that, she told us. Yeah. Here we are. So basically, yes, I do feel that, expert though I may be, no, I don't think I can treat and heal all problems. You need help. You need a team. And I mean, again, we have an osteopath who comes in for animals as well, and it often is a team effort. And that team has got to include the person with the dog as well. I always think and I think it needs the animal's own willpower maybe as well, or desire to get better. I think you need, for chronic disease, you need 3 things. You need the patient to want to get better, and I've met 1 or 2 dogs or cats that have just given up. They don't want to get better, and you can't do much about that really. You need the person involved to be able to give that time and care and attention and give the treatment. And you need the right treatment as well. So it's sort of 3 things in one, really.
Another question, if I may, please. I've been doing cat fostering over the last year and had about 6 cats come through my property. But did I hear you saying earlier about, just in regards to feeding, and raw food is best, but if you are going for the conventional, say, wet food and dry food, what sort of balance would you recommend? Because I tend to sort of do a bit of a combination of wet food with biscuits. I'd
say 100% wet and 0 dry.
Right.
Yeah, definitely. I mean,
no dry food at all.
Better not to.
Remember that say the dry food is good for the teeth.
Rubbish. Yeah. Give us nice raw food. Give some raw food to chew on. Chew on some nice bit of meat and so on as well. Yeah.
Can I ask why you're say against dry food?
I've just seen so many cats with kidney problems that looking back, dried food was the main part of their diet or part of their diet. I mean, I wouldn't say don't ever give any dry food, but the more wet food, less dry, the better.
Really?
You know? Yeah,
And
absolutely.
what about dogs and dry food?
Same thing, yeah.
Really?
Yes, the worst food is kibble. The way they process that is they denature the proteins, they add fats to it to make it tasty, and it's just awful stuff.
Yes.
Yes, look at the ingredients, just animal derivatives, what the hell is that, you know? So all the stuff that goes into these things. Yeah.
Bakers, so convenient in the supermarket.
Absolutely, yeah.
Terrible with the ingredients in them.
Yes, yes. Yes, indeed. The other thing is that legally the pet food companies have to put the level of proteins and fats, but not carbohydrates for some reason. So you don't know what carbs are in there, and it's mainly carbs. Carbs are cheap, proteins expensive, so they're full of carbs, you see. And the reason there's so much obesity in animals these days is mainly due to the pet food. Absolutely. And you know, if you feed your cat a nice sort of commercial diet and it gets diabetes, your vet will sell you a nice special diabetes diet, which is high protein, low carb, which it should be in the first place anyway. Yeah. And there's a huge problem with diabetes, with thyroid problems, with diabetes, and ending rather too quickly, but it's still good food. And their dog is called Lily, obviously, her name's Lily. She's now 16 years old, and she comes for acupuncture. I see her quite regularly, and she's still doing well. And she had Cushing's disease, and was put on conventional treatment, which made her desperately ill, and she's now just on homoeopathy for that and doing really well. So that's quite good. It's all about looking at the ingredients and going for high protein, low carb. That's what's most important, and as few additives and sugars as possible.
Yes.
That's basically it.
What's your opinion on fish diets? Because it's not.
You mean diets for fish, or fish as a diet for?
It's not part of the cat's natural diet. And also people say that fish contain a lot of heavy metals.
Mercury and so on as well, yeah. I think the cats do like fish. Cats love tuna. Tuna is not great for cats, I have to say, because of the mercury content. Cats will try and catch fish. So they're probably, fish, oily fish is good. Oily fish is quite good. That's what. I suppose, in a sense, yes, fish aren't part of that, but neither is beef, for that matter, or lamb. But we're not going to. Well, we should be feeding them as birds and mice and so on, really. But it's so as close to a natural diet as possible. But that's more to do with the protein rather than the type of protein, really. But oily fish, sardines, mackerel, are really good. Oily fish, megas and so on. That's great. But it's not so much really things like tuna and so on. And I think fish is better as part of the diet, really. But because cats do like fish, often if they're off the food, that's what they eat, of course, And cats are so hard to get to eat sometimes.
Is oily fish good for dogs as well?
Yeah, absolutely, yes. Yeah. All of us.
Yeah.
Oily fish.
Quite curious, isn't it, how cats are out of all the domestic world of animals, or the least that we can domesticate.
Yes.
We can't take them for a walk, really. Really, and they go off and when they want to, they come back.
Well, that's both the joy and the agony of cats, is their independence. Joy because they're independent, agony because it's hard to live with them, of course, yes. Yes, I have a lot of cats that are booked in, and then the day of the appointment, we can't find the cat, she's disappeared, There's a lovely cat I see a lot called Rocky, who I work in London one day a week in Bayswater in West London, and there's a cat called Rocky there, and he came for acupuncture. Well, he was supposed to come for acupuncture regularly, but we get the phone call, he's under the bed and I can't get him out, or I can't find him, and he's called Rocky because he's owned by Rockstar, by the way. Yeah. Actually, it's one of the most embarrassing moments. I'm very poor at recognising people, and they weren't mind me saying, because they're happy to be told this story. I had these new clients at Bayswater who came in. Mr. and Mrs. May came in with their cat. This was before Rocky, by the way, another cat. Fine, came in, we talked a bit, and the cat had a behaviour problem. And then Mrs. May later said, I think the problem first started when Brian was around tour a lot and I was away in a play. I thought, Brian May? Queen? How can you not recognise Brian May? He got me the most recognised rock star. I didn't recognise him. And of course, he's married to Anita Dobson, who used to be in EastEnders. You know, didn't recognise her either. Oh, anyway, the thing is, I mean, because Bayes was quite a knocking heels, a lot of celebs come in. So I see the computer because they're so just ordinary people normally. Like, you know, you just don't. They don't act like celebrities. They don't notice. But how not to recognise Brian May? I do not know anyway.
I've done the same as well. When I met Peter Gabriel, I didn't recognise him. Anyway.
Without telling tales, but I'm going to tell tales. The only celeb I didn't like was Stella McCartney, and it was great to meet a Beatles daughter because I'm a great Beatles fan. But she came along with the dog. It was her husband's dog, the dog, and her nanny and the baby. And she was on the phone to a fashion designer most of the time. She just wasn't interested, so I didn't know her at all.
What do you think about? Because I have seen a few times people desperately trying to take a cat for a walk with a lead,
a harness and lead,
harness. And what do you think about that? What's your view on that?
I mean, a small number of cats are okay on a lead. Yeah, they are. Yeah, I mean, I know you say you can't, but you can, to some extent, train some cats, and they will seem to be quite happy on a lead.
They will still go for it.
Oh, yeah, exactly, yes. Yeah. When I was a veterinary student, I had digs in Muswell Hill, and one of actually, this is a story. My landlady, a lovely family I lived with, and she had a Pyrenean mountain dog, female, and a Pekingese male, both unneutered. So when the Pyrenean came on heat, it was like poor little male dog. I can't quite reach, you know. So he never quite made it, luckily. But we always said if he couldn't jump that high. Anyway, but we always said if she had got mated and they'd had a litter of puppies, they'd have been Pyrenean mountain peaks. But anyway, the thing is, she had a neighbour who had a sheep as a pet, and this sheep she'd basically apparently she'd rescue as a lamb somewhere, and she would take his sheep for a walk on a lead, and it was wonderful. Yeah, lovely. So animals will cope with lead sometimes, you know. But there we are. We've got off track, haven't we, a bit here? Sorry, yes.
Yes. Is it true that raw chicken wings clear out the anal gland in dogs?
Certainly, anal glands are a fund of problems. You know, I love anal glands because they're so. Basically, the anal glands are scent glands, which are the same glands that skunks have, but luckily not quite so smelly. And what should happen is that when the bowels are emptied, it should squeeze around and empty them. The reason they often block up, well, one reason is if what's coming through isn't bulky enough. So yes, bones make it more bulky and empty the glands more easily. That's not to say that dogs on a raw food diet or eating bones never get anal gland problems. They get fewer problems, usually.
Do you get your meat from the butchers? Do you go and get scraps?
You can do. It's just hard to get a balanced diet because you need some meat for the protein, you need some offal for the vitamins and minerals, you need some bone because meat's high in phosphorus but low in calcium, bones are high in calcium, but you need the balance of it. It's better to get a ready-made diet, really. Much easier these days as well.
Richard, can I just ask about anal glands? My dog actually had his anal glands removed because he had repeated really bad, and he would be very, very depressed with it as well. And we tried all the conventional suite, and anyway, so he had them removed. And now I notice, this a few years ago now, but I do notice that dogs sniff him a lot. Because I think they can't quite make out, is he male or is he female?
Yes. Well, so they are scent glands, and therefore a lot of dog smelling is a scent gland, so it could be, yeah. Different smell, I mean, it can sometimes be the only thing to do, but it's not a very pleasant thing to have to do. Not very, but sometimes it works.
Yeah. And they did say that it might make him incontinent, thankfully.
It's always a possibility, yes, but Better not to avoid surgery if you can, I spend a lot of my time helping dogs not to have surgery. Any more questions? Have we exhausted you?
We've got time for one more if anyone's got one more.
No, I was just going to say that I think as far as diets are concerned, and I have been feeding my dog raw food diet now. He's 9, since he was about 2, and he's absolutely fine on it. And I think the benchmark is what comes out the other end. You know,
as in humans,
yeah, you know.
Yes, interesting. Most dogs on raw food, it does less volume, but it's firmer. When I was growing up, many moons ago, you often saw white dog poo around, white chalk, because dogs eat bones, and when it dries, it goes white. Nowadays, you almost never see white dog poo because it's just. But with raw-fed dogs, if it's left, eventually it will go white. Yeah, indeed. So yes, there's less smell usually. There's smaller volume. It's nice and pick-upable, and less anal gland troubles as well. Fewer anal gland troubles. Yeah.